One of the first things that they need to know is that we definitely need all of any treatment that they provide our soldiers, sailors, Marine airmen. We need to receive all of that information back. A lot of times there's a handshake or a phone call between providers, but in the military system we need everything in writing, because that airman may not be here much longer, and we need to tell the next set of providers caring for that airman what's been going on thus far. So getting us our information back in a timely fashion is very important, and also knowing that what they do has direct implications on the airman's ability to do their job. All of us, active duty, are taught to think as occupational medicine doctors. We're all taught to always be asking ourselves a question: what does this patient encounter, how does this affect this person's ability to do their job? Or this encounter with this family member, how does it affect the active duty member's ability to do their job? But we have to help our civilian counterparts in our specialty networks think the same way and write their notes to help us, the primary care, figure that out. Considering the whole person is, I think, something that American medical care is primarily moving away from. But for someone who has served active duty, it's absolutely critical. Things that the individual has experienced overseas during war environments absolutely impacts their ability to heal, the decisions that they make in terms of whether or not they're willing to risk surgeries, and their mental fortitude. It's all factors. And so recognizing that our soldiers have a unique set of traumatic experiences when they're trying to care for our airmen is very important as well. Each war brings a unique set of challenges and stressors. That's certainly true. But the modern military actually is much more decentralized. And so traumatic experiences, difficult circumstances, and unique injuries to the type of jobs that our soldiers, sailors, airmen, and Marines experience, our civilian counterparts should be considering that whenever they see one of our folks, whether they've been to a war zone or not. Of course. The biggest one is that I want our military providers to recognize this unique opportunity and to enjoy working with this unique population. It's easy for all of us to see a very limited pathway, and part of my job is to help all providers, all medical professionals at this base and beyond, to be able to see the opportunities that military healthcare provides. Out in the deployed location, it's the whole reason why I joined in the first place was because I know that physicians, especially family practice physicians, limited nationwide, and I know that in the military we're critically manned. And if I don't step up and serve, then the people who are defending our country are not getting the very best medical care there is. And that's what I care about, and that's what I want to promote.